giving you an opportunity to get the full story from the people who tell it best. This is Mediacom News Leaders.
And welcome to Mediacom News Leaders. Thanks for tuning in. I'm Carol Kelly. Joining us today from Shelter House, we've got Laura Iosbaker. Laura, welcome.
Thank you.
So you are kind of working with the Housing First program part of Shelter House. Can you tell us a little bit about what that is?
Sure. So Housing First is a newer model to the housing industry, and it takes away all the requirements. So our old standard was that individuals needed to meet certain requirements before they were able to earn housing. So they had to be sober or engaged in programming or be willing to do these things. And so Housing First really takes away all of those barriers, and it says we're going to give you your home first and then offer these services as a wraparound. So tenants aren't required to participate in those services, but they're there when they're ready.
Tell us a little bit about who is going to live at Cross Park.
Sure. So in Iowa City, Shelter House has established some criteria. The first is that they must be chronically homeless. And what that means is they need to have been homeless for 12 months consecutively, or they need to have been homeless 4 times in the last 3 years. And when I say homeless, I mean literally homeless, so living in a place not meant for habitation. And then along with that, they also must have a disability of some type, substance abuse, mental health, or physical disability. We've also established the FUSE model, we use the FUSE model, which is frequent users. So we look at their costs to the community and what agencies they've utilized, so that we're really serving those individuals who have cycled through all the systems. They haven't found something that works for them yet.
Then this Cross Park place, tell us about that. Is it open currently, or when are you estimating that to be open?
So construction's just finished. We are moving into our offices, and we hope that tenants will be in end of January, beginning of February. We're working with the tenants now to kind of do all that paperwork that comes before moving into an apartment and signing a lease.
And let's talk about that. What is the process like?
Sure. So a referral is made to me, and we do those checks of chronic homeless status and their costs to the community. And then we do outreach with those individuals, meet them, see if they're interested in the program. And then paperwork is everything from filling out forms to collecting a birth certificate, which sounds easy, but sometimes you have to dig for those certificates. So
tell us also about how long that people can stay at this facility.
Yeah, so it's permanent supportive housing. Individuals can stay as long as they wish, as long as they're upholding the lease. So somebody could stay, they could choose to move out after a month, or they could choose to live there for 15 years. It is their apartment as long as they're upholding that lease.
Talk to us about some of the resources. You mentioned that earlier. Tell us about those resources.
Yes, so we've partnered with different agencies in the community, and they are providing services on site. So we'll have a psychiatrist, a physical health provider, and then also somebody doing counseling on site. We hope in the future to incorporate other things like substance abuse groups, possibly yoga or meditation, whatever the tenants really identify as something they want to learn about. We'll then offer those services on site.
And what is the capacity in this new building?
There are 24 single bedroom apartments, and then below I mentioned there's offices, so there's 2 case managers staffed there, and then our front desk, our reception is staffed 24/7 as well.
And you said there are specific resources that are available for the tenants. Tell us a little bit about just some of the successes and some of the opportunities that that the residents have taken advantage of.
So we haven't moved anyone in yet, but we have started engaging with them, and I do anticipate them utilizing the services on site. So really building that rapport is our first step. A lot of these individuals have failed all of the systems we have. And so really building that trust back up and helping them to self-identify goals, things that they want to work on, and then providing those services, whether it be through Shelter House or in the agency if that service already exists.
And is there a cost for these residents?
So we've partnered with the Iowa City Housing Authority, and we have vouchers. So they will be responsible for 30% of their income for the rent.
That's fantastic. Anyone that would want to learn a little bit more about Shelter House and everything we've talked about today?
Yeah, go visit our website, so shelterhouseiowa.org.
It's a pleasure, Laura. Thank you so much for joining us.
Thank you.
This has been Mediacom News Leaders, your opportunity to get the full story from the most reliable sources.